Hi, I'm Dr. Glenn Charles. I'm here today to answer a question from a young man named Justin, who I believe is 25 years old and is wondering if he's too young to have the procedure. He's been reading online on several different forums that he might actually be too young, and some of the doctors are recommending not to do surgery or at least hair transplantation on patients of his age. Justin, this is a great question. I have lots of patients between 18 and 25 or 26 that ask the same question, and my answer to that is I really feel there's no specific age to make someone an appropriate candidate for hair transplantation. I really think it depends on many different factors, including your age, the amount of hair loss that you have, the pattern of hair loss that you have. Your maturity level is really important, and then again, with any hair transplantation procedure, what are your expectations? Maturity level is important in this type of situation because you have to be realistic and understand that whatever we do or whatever any hair transplant doctor does at this age is permanent, and whatever results you're going to have has to look good now at age 25 or 26 and has to still look good when you're 40 and 50 years old. You also have to understand that if you do the strip procedure, which most patients are doing at this time, you're going to have a little thin, fine scar in your donor area, and you may have a slight limitation as to how short you can cut your hair in the back. So that's another important factor. The type of hair loss you have, how much hair loss you have, what's your family history of hair loss. We try and figure out as much as possible where you're going to go from here. Are you taking any medications to try and prevent hair loss? That's where the maturity level comes in. Do you understand all these different aspects of hair transplantation at this age? And often at age 25 you do. A big thing for me is I understand what the younger guys are feeling, and I also think that I don't see a time in a person's life when it's more important than it is when they're young. So I don't go by age, I go by the other factors that we talked about. And you have to remember that things have to look good now and later. So if you have that picture in your head of your high school graduation photo and you're insisting on having that, that might not be a great idea. If your expectations are realistic and you can stay at a hairline height, because I know you're talking about reconsidering lowering your hairline, as long as it's an appropriate spot where it could look good now when you're in your mid-20s and also look good when you're in your 40s and 50s, I think there's no problem with the age. I wish you good luck.